welcome to a special edition of Scholars Hub at Home in partnership with the Canada-UK Foundation and Canada-UK Chamber of Commerce. I'm Julie Lafford. I'm the Executive Director of Alumni Engagement at York University. Thanks for joining us today. We're really excited to partner with Canada-UK Foundation today. For 50 years, the Foundation has had this single vision of promoting Canada and the UK through education. They're joined today by their partners at the Canada-UK Chamber, who at 100 years old is Europe's oldest business networking chamber. I also want to welcome our speakers, Dr. James Orbinski and Dr. Simon Frost, to Scholars Hub at Home. In just a few moments, Dr. Robinski will be speaking to us about the work researchers are doing at the Dahdaleh Institute for Global Health Research at York University and in 8 African countries. Then Dr. Frost will speak to us about the science behind robotics, next generation artificial intelligence, genome science, and much more. But first, as is our custom in Canada, I want to begin by acknowledging the land on which York's campuses are built. As this event is virtual and we're all not gathered in the same space, and indeed we're not all in Canada, I recognize that the following land acknowledgement might not be for the territory that you're currently on. And if this is the case, please take the responsibility to acknowledge the traditional territory you're on and the current treaty holders. As a member of the York University community, I recognize that many Indigenous nations have long-standing relationships with the territories upon which York campuses are located, which precede the establishment of the university. York University acknowledges its presence on the traditional territory of many Indigenous nations. The area known as Takaronto has been caretaken by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. I am truly grateful for the opportunity to live and work on Treaty 13 land. We'd like to get to know our audience a little bit better with a quick poll before each of our lectures. And given the global scope of today's lecture, today's poll is, where are you joining us from today? So if you're viewing this on Zoom, you can just click on that Q&A button at the bottom of your screen and type in the region and country that you're in. And for our Facebook viewers out there, feel free to use the comment section to give us your answers today. I see the answers coming in: UK, Toronto, UK, London, Canada, Toronto, Brampton, England, Markham, Guelph, Wilmington, USA. Lots of folks from Toronto and all over. I think we also have some folks joining us from I think I saw some African countries, Nigeria and so forth. So it's really wonderful to have such a great group here today. If you need help with the Zoom webinar at any point during this lecture, you can click on that same Q&A button below and enter your question. Our team is in the background ready to help you. And later on in the lecture, the same button can be used to submit questions to our guest speakers today. As a reminder, your comments and questions are visible to all of our panelists and staff behind the scene, and we ask that all submissions are respectful and relevant to today's topic. So without further ado, I am really thrilled to welcome York University President and Vice Chancellor, Dr. Rhonda Lenton. Dr. Lenton will bring us some opening remarks and introduce our speakers. So over to you, Dr. Lenton.
Thank you so much, Julie. And thank you also to our partner for this event, the Canada-UK Foundation and Canada-UK Chamber of Commerce. Before we begin, I do want to take a moment to share a couple of dates from York that I think are relevant for today's event. Everything we do at York is very much shaped by our vision to provide a broad demographic of students access to a high quality teaching and learning experience at a research-intensive university committed to driving positive change, both locally and globally. That vision has shaped our actions in responding to COVID-19, in the delivery of our programs, how we've conducted our research and responded to needed questions around the pandemic, our support of our community partners, and our service for our students. I'm pleased to say that we're actively planning for a safe return to our campuses for the fall 2021 term. Those plans are centered on bringing classes and co-curricular opportunities back onto our campuses as much as possible, but always prioritizing the health and safety for all of our students, faculty, course instructors, and staff. Classes held on campus will be delivered in a small group format that maximizes interactive learning. As we look to make more on-campus learning opportunities available to our students, access to high-quality remote learning will continue, especially for those who may face health or travel restrictions. The dynamic nature of the pandemic will, of course, mean that we'll have to remain flexible in our approach in the months ahead. I look forward to sharing more details as we finalize those plans. At the same time, we have been strengthening our equity work, just recently releasing 2 documents that will guide our approach to combating anti-Black racism, both on and off of our campuses, and contributions of individual faculty, staff, and students who have been immersed in this work for years. Addressing anti-Black racism, a framework for Black inclusion, and the accompanying draft action plan on Black inclusion for further consultation were developed based on extensive consultation and feedback received through a series of discussions with our Black community members at York, including alumni, faculty, instructors, staff, and students. Equity and inclusion are embedded in York's founding principles, and as such, we are committed to addressing systemic anti-Black racism and to providing equitable access to learning, teaching, research, and professional environments that are respectful and inclusive for all. I encourage you to review our framework and draft action plan, as well as our Indigenous framework, and to share your feedback on these documents at yorku.ca/abr/action plan. I would also like to invite you to join me at the York U of the Future alumni event on April 30th, where I will be joined by students, faculty, and alumni panelists to discuss the opportunities, the challenges, and the priorities for the university in 2021 and beyond, and to answer questions from alumni. More information about that event is coming soon, so please keep an eye out on your inboxes for the invitation, which will be sent out shortly. So turning to today's event, I want to highlight that since March of last year, researchers from across the university have been applying their knowledge and their expertise to addressing the challenges arising from the COVID-19 pandemic. One of these researchers is our very own guest speaker for today's Scholars Hub at Home event, Dr. James Orbinski, professor and director at the Dahdaleh Institute for Global Health Research at York University. With him today is Dr. Simon Frost, professor of pathogen dynamics, London School of Hygiene and Tropical Medicine, and principal data scientist at Microsoft Health. Thank you both for being here with us today. I also want to take just a moment to acknowledge a special audience member joining us as well, Victor Dahdaleh. Victor is not only a York University alumnus, but he is also an important donor to the university. In fact, he donated the largest gift ever received from an alumnus in York's history. With Victor's support, we were able to establish the Dahdaleh Institute for Global Health Research, which engages with health policy, practice, and science to strengthen global health equity. Thanks to Victor's visionary gift, the Dahdaleh Institute has become a platform for securing valuable partnerships with global scholars and key organizations, including the United Nations and the World Health Organization, and collaborating with other leading universities around the world on the most pressing issues of a generation. The significant impact that the Institute has already made on global health and healthcare worldwide is a direct result of Victor's generosity. In November, researchers at the Dahdaleh Institute, in partnership with Doctors Without Borders, launched the Safe Water Optimization Tool, just as one example, the first concrete application of artificial intelligence for improving safe water supply in humanitarian operations. The tool will help humanitarian workers in refugee camps ensure that water is free from contamination and safe to drink. And it is already being utilized in camps in Nigeria, Bangladesh, and Tanzania. Heavens, Tanzania. I knew I would get that out eventually. The investments that Victor has made have also helped our researchers secure grants in global health, disaster and emergency management, mathematical modeling, and a variety of other fields that will help us better understand and respond to the COVID-19 virus. Victor, I'd like to invite you to come on screen if you can. We're just so incredibly grateful for your gift and for your vision and recognition about the importance that universities play in addressing some of the serious challenges that we're faced with. We're very happy that you could join us today.
Well, thank you. Thank you very much, Rhonda. Can you hear me?
Yes.
Yeah, okay. Thank you very much. It's my pleasure to be here today. Welcome everyone who's on this call. I'd like just to mention a few things. You know, I did study at York University when I was living in Toronto in those days. And York, unfortunately, they forgot about me for nearly 30-something years. And when they discovered me, they were so nice to me that I end up being the largest donor. And I think it's a plus for York, the management and the vice chancellor and everybody else, how they managed to do that. I'm very proud that we got Dr. James Orbinski, who's a leading vital effort to improve health around the world through the Dahdaleh Global Health Institute. And I think with partnership and collaboration, we will take it further, step by step, faster. And I look forward to hearing from James and Simon about their efforts to manage the future pandemic in Africa and other countries around the world. I'd say again, welcome to everyone, and I look forward to attending the whole event today. And thank you very much, Rhonda, again.
Thank you so much, Victor. And now it's my pleasure to turn things over to Stephanie Beck, Acting High Commissioner of Canada for the United Kingdom, to introduce our first speaker.
Thank you very much. I'm really delighted to be here with all of you today. It's a real pleasure for me for 3 different reasons, actually. Firstly, as Acting High Commissioner here in London, it's very gratifying to see the strong connections between Canada and the United Kingdom, especially in this field, which is a priority for both our governments. So a very warm thank you to you, Dr. Lenton, and to York University, the Canada-UK Foundation, and the Canada-UK Chamber for nurturing these special and historic connections. Maintaining these ties is more important than ever in today's changing and challenging environment. It's not just about the science, it's about the people-to-people connections and the mutual support that we all need these days. And secondly, I'm very much looking forward to hearing from Dr. James Orbinski about the work being done in the Dahdaleh Institute. At the High Commission, we work very closely with Victor Dahdaleh on a whole range of other issues, mostly cultural, which is also fantastic for us. The research being discussed today will receive more than $1.2 million in funding from Canada's International Development and Research Centre. It's one of only 9 projects selected for funding through the Global South COVID Response Program, which is focused on low and middle income countries. This is part of Canada's foreign affairs and development objectives, funding and supporting high quality research in developing countries, and sharing knowledge between researchers and policymakers will inform and drive progress. And finally, I'm very much looking forward to hearing from the wonderful researcher that it is my pleasure to introduce to you today. So speaking on behalf of the Canada-UK Foundation is Dr. Simon Frost. At Microsoft, Dr. Frost works on Project Premonition, a moonshot project to monitor the biological environment for disease threats. As they say, what if we could predict pandemics like we predict the weather, or maybe better than we predict the weather? Dr. Frost also coordinates a pandemic preparedness project. This develops and maintains a platform for running simulations of infectious disease transmission to help guide policy in collaboration with academics from all across the United Kingdom. Dr. Frost developed an analytics system for HIV that is currently being used in North Carolina in collaboration with the State Department and UNC Chapel Hill. He has an extensive range of international collaboration with researchers all across Africa, Indonesia, and the Philippines. He's an active proponent of open science, particularly in disease modeling and in bioinformatics. So welcome, Simon. I invite you to please turn on your video and mic. A pleasure having you with us today.
Thank you very much, Bethany, for that kind introduction. Welcome, everyone. I'm going to start sharing my screen. So today I'm going to talk about some of the work that we're doing at Microsoft Health on how potentially we could predict epidemics like we predict the weather, or as Stephanie says, perhaps better than. Now, one of the things that the COVID-19 pandemic has demonstrated is the power of data. And not just data, but also the use of statistical models and mathematical models to turn those data into information that we can use to make decisions. I'm sure that many of you have seen this dashboard from Johns Hopkins University, which compiles cases of COVID-19 as well as deaths, displays them on a map, shows a sort of worrying league table of those cases, so that we have an idea of where the epidemic is. Relevant to Dr. Robinski's talk later, we see that there aren't that many cases reported in Africa, but that's something that models can be used to try to address in terms of how often a disease is reported. Another thing that has really come on to central stage is the use of genetic sequencing of the virus, which has allowed us to track subtle variants of the virus that might have different properties. For example, variant B117, it's not a very accessible name, but it's one that arose in the UK and then has subsequently spread around the world due to its higher transmissibility. And it's only through accessing samples and then processing them in order to be able to get sequence data from them that we can monitor those things. Once we have data, then models can turn those data into nowcasts. That is, what's going on right now in a way that's more digestible in order to make decisions, as well as short-term forecasts. If everything was to remain the same, then how many cases are we going to see in the next week or 2 weeks? And then furthermore, looking further out and trying to make decisions about what we should do, more complex models can help to guide policy decisions by considering whether we should have contact tracing or local or regional lockdowns in order to be able to prevent transmission of COVID-19. But what about the next pandemic? Because we know that there will be one. What if we could monitor and predict epidemics like we predict the weather? So just asking the question, what's the weather right now? We could look outside, we could open up an app and find out where the weather is virtually anywhere in the globe. But it's much harder to do that with an infectious disease before even we start to talk about forecasting. Firstly, pathogens are invisible to the eye. We often only notice that a pathogen is around when people become sick. And diseases are often identified by symptoms, not through diagnostics or sequencing. And because of that, we often confuse different diseases with each other. So we might have a respiratory infection, which could be COVID-19, it could be flu, it could be a rhinovirus, and so on. And it's quite hard to tease those apart through symptoms alone. Imagine if you could only tell whether it was raining or snowing, but not distinguish between the two of them. Moreover, there are also delays in data. So data might be collected out in the field somewhere, and it might take some time, perhaps several weeks, for that to get entered into a central system. So imagine looking at the weather, but only be able to see what it was like 2 weeks ago. And that's really where we are in terms of infectious disease surveillance. So our goal, and this is a shared one, I think, with many people, is to develop an AI platform for continuously monitoring and forecasting the biological environment, or the biome, with the idea that we can't forecast anything if we can't sense that. So to address that, we need to develop a network of biological weather stations in order to sense the biome. We'll need new methods for data that we haven't seen. So we need to create new AI models that can process those data in real time and then present those to decision makers. And we need to show that even small networks continuously produce value. So in order to be able to scale, we need to start off small. Those still need to be valuable, but ultimately we need a large system in order to be able to monitor in a global setting. So what we're trying to achieve is to generate something that's economically sustainable, and a flywheel that drives that coverage and essentially allows the network to spread. And the bigger it gets, the smarter it gets. So like many AI platforms, it's data-driven, and so the more data we have, the better we can predict and forecast. So our first efforts in this direction is to create a biological weather station for arthropods. Why arthropods? Well, mosquito-borne diseases are widespread, are responsible for over 500 million clinical cases a year. Arthropods are also important in terms of pests, in terms of global malaria, and we spend an awful lot of money on both surveillance and interventions on those. Mosquitoes are not just vectors of disease, but also are an indicator of ecosystem health. So we can monitor how climate change might be affecting the environment by looking at mosquitoes and other small arthropods. And then also we can think of mosquitoes as flying syringes. They're flying around, they're trying to find blood meals, and when they do so, they're taking tiny samples of blood that we can process further and understand what animals the mosquitoes are biting, and indeed whether those animals are carrying any infections themselves, even if they aren't directly mosquito-borne. So our vision is to have a network of robotic smart traps which lure, identify, and capture arthropods. And then that network filters high-value specimens from the environment and preserves them. And then once we have those, we can prioritize specimens for sequencing. Sequencing is still the gold standard for us in order to be able to identify either a mosquito or a pathogen that it's carrying, but it's very expensive. So what we want to try to do is to select those specimens that are going to give us the most information for the money that we spend on sequencing. We started this work as a deployment in Harris County, where we're trying to set up weather stations that operate 24 hours a day, 7 days a week, that allow us to pinpoint exactly where there are flare-ups of mosquito populations, flare-ups of pathogens that are spread by mosquitoes. For example, West Nile virus, which is endemic in the United States, as well as invasive pathogens like dengue and chikungunya, which could potentially spread across wide parts of the US due to climate change, but have yet to properly invade. So what we hope this will achieve is situational awareness. So what's going on right now in the environment, to be able to combine that data with model predictions, and then help to plan interventions. And then what our platform will try to do is to collect data on how people are deciding, how they're turning that data into the decisions that they make, so that our system learns from people in the same way that people are learning from the system. And the rationale for that is that because without more data, we can't predict and present disease outbreaks and epidemics. We can't predict and prevent invasive species and agricultural pests. And we don't know how to manage our biodiversity and ecosystems in the face of climate change. So with that, I'd like to thank everyone. And if you'd like to know more about our system, please go to microsoft.com/premonition. Thank you very much.
Thank you so much, Dr. Frost, for that really interesting talk. I'd like to now introduce our second speaker today, Dr. James Orbinski. He's a professor and the inaugural director of York University's Dahdaleh Institute for Global Health Research. As a medical doctor and a humanitarian practitioner and advocate, a best-selling author and a leading scholar in global health, Dr. Orbinski believes in actively engaging and shaping our world so that it's more just, fair, and humane. A champion of health and humanitarianism throughout his career, Dr. Orbinski has extensive leadership, advocacy, and research experience in global health. He has worked providing medical humanitarian relief in situations of war, famine, epidemic disease, and genocide with Médecins Sans Frontières, Doctors Without Borders. He is an officer of the Order of Canada and has received the Meritorious Service Cross for his leadership in providing direct medical relief in Kigali during the 1994 genocide in Rwanda. And now I'd like to welcome Dr. Robinski to turn his camera on and begin his lecture. Over to you.
That's great, Julie. Thanks so much. I'm just going to share my slides here and just ask you if you can see those. Can you see those, Julie?
Yep, absolutely.
Okay, perfect. All right, great. Well, I would like to begin by thanking Rhonda, of course, the president of York, the Scholar Hub organizers, the Canada-UK Foundation itself, and the Chamber of Commerce, and of course, Victor and Mona Dahdaleh, who have really been wonderfully generous in supporting the emergence of the Dahdaleh Institute for Global Health Research. The Dahdaleh Institute for Global Health Research takes a critical problem-solving approach with a view to improving the effectiveness, the equity, and the excellence of global health research, policy, and practice. Rhonda, the president of York, did refer to one of the things that we're involved in, the creation of a safe water optimization tool. And we have many, many projects that we're engaged in. We're modeling, for example, the health impacts of climate change in Malawi using systems dynamics modeling and agent-based modeling. We're also deeply involved in the use of short documentary film, now award-winning short documentary film, as a way of participating in the policy formulation process at the Paris COP talks around climate change. And we are involved, of course, in the use of artificial intelligence and disease modeling for the containment, control, and mitigation of the COVID pandemic. I have been asked today to just simply address this this question. Can artificial intelligence and disease modeling be used to improve public health interventions and vaccination strategies to counter COVID-19 in Africa? It's a pretty complex question, but it has a very straightforward answer. And the answer is yes. The project that I'm going to talk about is led by a professor here at York University, Jude Kong, and he, as well as a number of other professors at York, Jihang Wu, Ali Asghari, and myself, are working with a team of over 50 academic and government researchers across 8 African countries to apply artificial intelligence and disease modeling to the challenge of containing and controlling COVID. Some of our African partners are in South Africa, Botswana, Eswatini, Zimbabwe, Mozambique, Rwanda, Cameroon, Namibia, and of course in Nigeria. The focus that I just want to kind of bring us to is to COVID. Of course, we are, as Simon alluded to earlier, we're all, I think, deeply familiar with this set of images. We know that globally, there have been about 125 million cases of COVID infection, and that with those, as of early this morning, about 2,700,000 people have died of COVID. We also know that there are waves of COVID over time. And if you just look carefully at this graph, you can see that there are peaks at different points. There's a first wave, there's a second wave, and there's also a third wave. And if you kind of break those down, they can actually be broken down into smaller currents or smaller variants, if you will, of concern of the original COVID resident organism. The pattern by which these emerge is extremely important, and I'll come to that in a few minutes when I talk about why artificial intelligence and machine learning is so valuable particularly in Africa. Now, I think it's important to recognize who gets sick with COVID. What we know generally is that whether you're in the north or whether you're in the south, there are very particular patterns of vulnerability. And what we know is that it is usually the people who are at the margins of society or people who are already in some way structurally vulnerable within society who are most prone to COVID infection. And so on the left, we see a man in an ICU bed. Well, this is a Black American who is suffering with active COVID infection. On the right, we see an aid worker with Médecins Sans Frontières who is trying to enact COVID response programs in Malawi. And I'll come to Malawi in a few minutes. What we know in Malawi, for example, is that there are massive increases in the number of confirmed cases now in what is the second wave of COVID infection in the country. That second wave is driven not by the resident strain of COVID, but is driven by a second strain of COVID, the South African strain, not the one that Simon referred to earlier. This South African strain or variant of concern is 7 times more, has caused 7 times more confirmed cases. It is much more transmissible and it has a higher mortality associated with the resident or first strain of COVID. In Malawi, one of the biggest issues that people are facing on a very practical basis is shortage of oxygen. Oxygen is the single most important treatment for COVID infection. And what people are seeing, and this is typical of COVID infection now throughout Africa, what people are seeing is that death comes faster than the first wave. And people are genuinely shocked at how quickly the organism is causing, or the virus is causing, clinical illness and death. Many people are actually staying at home and are afraid to go to the hospital because the hospital capacities are significantly reduced. And why are they reduced? Well, many nurses and doctors are actually staying away from hospitals because they are unvaccinated and they themselves don't want to become sick with COVID. And vaccination in Malawi, like many parts of the world, and especially the developing world, is dependent on the WHO created platform for access and distribution of vaccine. That platform is called COVAX. So I point this out, all of these various factors, I point this out to indicate to you that the context of infection is always very specific. And there are particular circumstances, causes, and conditions that are relevant to any kind of intervention. So all that's global ultimately is first and lastly local. It emerges from somewhere and has very specific impacts. And so the consortium that we have created, the Africa, Canada Artificial Intelligence Disease Modeling Consortium, has three core objectives. The first is to aid policymakers in mitigating or suppressing outbreaks of COVID in the 8 target countries. The second is to evaluate the relative effectiveness and potential biases of public health interventions in each of these particular countries. And the third is to support local communication strategies to address misinformation about prevention and treatment. And all of this is really singularly focused on the most vulnerable people within the 8 countries that I've previously alluded to. So what you see is that, just even from the brief description that I've offered, as well as the biology and the virology of COVID, there's a wealth of complexity to the causal conditions that are at play in the emergence of COVID within a particular community and in the efforts to contain, to control, and to mitigate. Now, I certainly am not going to go through this graph here or this image here, but what it shows generally is the degree of complexity at play. There are economic, environmental, health, social, political, and governance issues that are absolutely central to appropriate interventions that will, again, seek to contain, control, and mitigate the infection. So what we've done with our consortium is essentially we've taken a 2-prong approach to integrating social vulnerabilities into our analysis. The first prong attempts to take WHO, World Health Organization values framework and vulnerability indexes to identify specific social vulnerabilities. And we also use geospatial mapping of vulnerabilities according to those framework criteria as a first effort to describe the complexity of a particular outbreak, for example, of COVID. The second prong is that we use artificial intelligence smart algorithms to really fine-tune provincial and national strategy. And so artificial intelligence, at its most basic, if you just look along the left axis where you see the numbers 1 to 7, you can see each of these numbers represent a variable. It could be any one of a number of different things, but those 7 variables can interact with a second layer of variables and a third layer of variables in increasing degrees of complexity. And those are related, those are shown to you through the black lines and then the red lines. Those complexities can be understood, and those complexities can be identified and correlated with particular policy objectives. So at its most basic, artificial intelligence can be used for hotspot analysis of, for example, COVID, shouldn't say 29, it should be 19, of COVID-19 in, for example, one province of South Africa, the Gauteng province of South Africa. On the left, where it says before, you can see that in Johannesburg and in the upper region, town of Saraton, there are little bright red flashes of color. And these indicate a high incidence of COVID at a certain point in time. With public health interventions, at a second point in time, you see the after slide, where the degree of redness is actually significantly diminished. And so what this shows is that the public health intervention actually worked to reduce the emergence of a particular, to reduce the incidence of COVID in a particular region. And so at a very basic level, these are very useful tools for understanding interventions and also for communicating interventions to policymakers and to the general public. Now, you can complexify this by actually developing an integrated approach to public health optimization. And so what we've done is we've developed, this is just one example, but we've developed a series of optimized goals and also variable descriptors. And so, for example, we look at the probability of contracting of the COVID virus. We look at the probability of contracting severe illness or of mortality, the existence of antibodies, and then social vulnerabilities, as I previously described, to determine the probability of contracting severe illness, and to do so in a way that is simple, easy, and easily communicated to users. Each of these 4 boxes are known as algorithm or algorithmic parameters. And so what we try to do, and I'm just going to show you, I don't expect us, I won't go through this in great detail, but I'm just showing you the complexity of how then these algorithms are used to define particular outputs using machine learning and artificial intelligence. And these, what we have here are imaged for you are neural network parameters and neural network systems by which various variables are analyzed to give us a meaningful outcome. Now you can use these networks or these neural networks as a single layer or in multiple layers through successive applications to particular data sets. The other thing that we can do is that we can learn, and the machines can learn and can improve their predictive capacities through the use of what we describe as pre-processing algorithms, which are really the 4 variables or the 4 parameters that I described earlier, and taking those variables and developing an algorithmic code essentially that allows us to teach the system to learn. And so in the simplest example, I think, of an outcome that is very, very meaningful here is that we've been able to use this approach to give specific advice to the province of Gauteng in South Africa and to the South African government about vaccination strategy. And we've been able to look at the complexity of variables and been able to tell with a high degree of certainty that the appropriate officials that vaccinating the 20% of the population that is at higher risk, that this can lead to a 5-fold decrease in severe illness within South Africa as a whole. And now this advice has been taken up by the Ministry of Health and is being used as part of their overall strategy for vaccination. This is just one example, and there are many, but I'm not at liberty to disclose the full details of our work, but I can certainly tell you about this. But this gives you a very concrete example of how useful artificial intelligence and machine learning can be, and in fact is, to the very real problem of COVID in our 8 partner nations and of course across Africa as a whole. At this time, we've already developed in partnership with our 8 national partners COVID dashboards for each country. And this is an example of the COVID-19 dashboard that is being used in South Africa. And this has been, this particular dashboard has been developed very, very practically and very concretely by our colleagues at Wits University in South Africa. And we're working with each of our partners to develop nationally specific dashboards that are relevant to their particular context. Now, what does this mean for the future? Well, we know that with COVID, there is much, as I've already alluded to, much complexity to the disease. Now, as science evolves literally on a daily basis, we have more and more understanding of that complexity. And so, for example, what you see here, what you see depicted here is the antibody response against 4 variants of concern. And you can see that there are different responses. We don't need to go into this in great detail, but you can see that there are different responses for different categories of patients. Now, this is extremely important because it tells us a great deal about the efficacy of vaccines, of different vaccines in different subpopulations of people, and whether or not certain vaccines will work against emergent variants of concern, or whether they won't. Now, this can be integrated into machine learning and artificial intelligence applications for particular policy applications in very specific locations. Now, of course, this depends, as Simon said, on data and data quality. But this gives you an idea of where and how machine learning and artificial intelligence can have ongoing meaningful applications in the context of COVID and also in the future. Now, Simon alluded to very aptly and very beautifully described what's possible in terms of future directions for use of artificial intelligence and machine learning. And I'd just like to simply say, yes, these are really, really exciting possibilities. And machine learning and artificial intelligence has absolutely incredible implications for how we understand and how we respond to local or pandemic disease. The Africa-Canada Artificial Intelligence Partnership that I've described really depends on the use of innovation and on understanding vulnerability. And understanding vulnerability, marrying that with innovation and seeking greater equity, greater effectiveness, and being committed to excellence in research for global health can lead to better global health for people around the world. So a commitment to equity and to innovation are absolutely central to global health. And without this dual commitment, we will achieve greater inequity. And so with that, I will end my comments and thank you for the opportunity for sharing this work with you.
Thank you so much, Dr. Robinski, for your presentation. You can actually stop sharing your screen now, and I'll welcome back Dr. Frost for the Q&A session. Just want to make sure great, I see you both now, wonderful. So we have about 10 minutes or so for questions from the audience. So audience members, as I mentioned before, use the Q&A button below. Folks on Facebook, use the comment section there, please, and the team will get your questions to me. So I already have several questions in queue for you, Drs. Orbinski and Frost. The first one comes from Nicole Weckman, who asks, can you comment on the importance of good diagnostics and testing systems to generate real-time data for the models?
Go ahead, Simon.
So I think in the context, particularly the one in the Global South that Dr. Robinski was talking about, I think it's very important in the context there are so many co-infections and so many things that would be confused with a general respiratory pathogen. The problem there is that you require resources and infrastructure, particularly in order to be able to do that. And so it's trying to know when and how to apply those tests, I think, is a big question.
Yeah, and I would add to that and just say that, you know, particularly in the context of our theme today, artificial intelligence and machine learning, any type of data has some degree of utility, has some potential degree of utility. But the more clinically relevant that data, the more specific to a particular patient, and the more reliable that data, the higher the sense, we call it sensitivity and specificity, the higher the sensitivity and specificity of that data, the more useful it is for clinical decision-making or for public health decision-making. So what I would say is that diagnostic data, absolutely critical for meaningful, reliable machine learning and artificial intelligence outcomes. Also, obviously, absolutely critical for clinical care of a particular individual patient. And these things are not, these are not separate, right? Clinical, public health are actually deeply interdigitated, and even more so today than over the last, let's say, 70 or so years. So.
Thank you both for that. The next question is from our very own Dr. Jude Kong, who Dr. Robinski mentioned earlier and is doing some work with. Dr. Kong says, great speakers. I'm super excited with the robotic smart traps. In 2020, close to 400,000 or more people die from malaria, which is caused by the female mosquito. May I know if there are plans to apply the robotic smart traps in high malaria prevalence communities, mostly around Africa?
Yeah, so that's certainly our goal. We have ongoing collaboration with the Jane Goodall Institute in Tanzania for us to tackle mosquito dynamics in an area where the biodiversity is much higher, where the weather, so we just have to make our traps robust to extremes of weather as well. And we're working with modelers in order to be able to take the data that we would produce and apply that to different disease systems. We're starting off mostly in Harris County because just of access and permitting and so on. And there's also a rich legacy data set that we can use to benchmark our approach. But that's certainly our goal, is to put it where it is most relevant and where the underlying data is far more sparse.
For your answer. Next question is, how do you think predictive modeling through AI can also impact other infectious diseases and subsequently the future of preventing another pandemic?
Yeah, go ahead, Simon.
No, you first this time.
Well, I think we're at we are. I was going to say we're at early stages. I actually don't think we are. I mean, what Simon outlined is really it's not in the distant future. This is very much in our hands in terms of creating the tools and creating the models and creating the understanding of complexity that will have impact on major infectious diseases around the world. Simon talked about malaria, there's dengue, there's chikungunya, Zika, any one of a number of existing and now emerging infectious diseases can be better understood through the application of this knowledge in these systems. And I would also say that today we're talking about infectious diseases, but the opportunity through these technologies and through this very careful and systematic approach to understanding complexity is well beyond infectious diseases. Infectious diseases are quite attractive for this kind of system, this kind of thinking. But there are applications to chronic diseases, there are applications to public health systems, there are applications to clinical health tools, there are applications to broad social structural determinants of health. So these tools are really, really powerful. And in the first instance, yes, infectious diseases, we can and are having a big impact, and we will continue to have an impact there. I'm absolutely convinced. And beyond that, there are many applications that are very much on the horizon. And perhaps Simon, you might want to touch on some of those.
Yeah, I got all of that entirely. I think that we can learn directly from COVID-19 in terms of other respiratory pathogens. We've seen flu rates go way down because of all these restrictions that are designed to prevent respiratory spread. It would be great if we could try to repurpose some of these approaches to look at gastrointestinal illness or waterborne disease. But we can also use what we've looked at in terms of COVID predictions and actually use that to reveal the health disparities that you spoke about, James. So I think that by collecting all of these different data sets and using them to predict just one infection, there's no reason why we can't come up with a full battery of infections and then really give people an idea of their environmental health, not just in terms of air quality, but in terms of their disease risks as well.
Thank
And
you.
the other thing I'll just add there is that these are incredibly powerful tools for identifying highly vulnerable people, highly vulnerable groups of people, and for identifying appropriate interventions that can reduce those vulnerabilities. That's very much the focus of the Dahdaleh Institute, is increasing equity, increasing effectiveness, and increasing and with a commitment to excellence in science. And so these tools really are absolutely powerful in that regard. So.
Thank you both, Dr. Frost, Dr. Robinski. We're actually at time now, so I'm afraid I can't get to any more questions. I do want to thank you both once again for spending this time with us, for sharing your knowledge and your work with us. It's been a pleasure to be able to bring your work to Canada, the UK, and around the world today. Thank you again.
You're very welcome. You're very welcome.
Right. I also want to thank our special guest today, Dr. Rhonda Linton, President and Vice Chancellor of York University, Stephanie Beck, Acting High Commissioner of Canada to the United Kingdom, and of course, Victor Dahdaleh. Thank you all as well for taking the time to be with us today. And before we say goodbye to you in the audience, thank you for joining us. And we have one last poll question for you that will appear now. How would you rate your understanding of today's topic following this discussion? Please take a moment to respond. And while I have you here, I will just plug our next Scholars Hub event, which is on Wednesday, April 7th at 12 p.m. Eastern Time. It's a conversation about relationships, families, specifically marginalized families, and within the context of their children's schooling. Then on Wednesday, the 21st, again at 12 Eastern Time, we have a special Earth Day themed Scholars Hub with Dr. Eric Miller in the Faculty of Environmental and Urban Change. If you want any information about any of these events or other upcoming events, you can check out our website, yorku.ca/alumni-and-friends/events. And as ever, please send any and all feedback to us at alumni@yorku.ca. Until next time, stay safe.